Next up, it's dystonia. I wanted to talk to you about one of Astrid's secondary conditions called dystonia. Dystonia is a neurological muscle disorder which can lead to the muscles contracting and going into spasm. This can cause repetitive twisting, contracting type movements which are involuntary. Astrid has these multiple times a day and they can cause her a great deal of pain. She quite often gets stuck in a dystonic cluster where she can have lots of kind of muscle spasms at the time, and these can be really painful for her, and they don't usually stop unless we intervene. Now usually a position change is enough, but sometimes she needs to have rescue medication to help relieve the muscles and make them relax. Now for Astrid, this is something called buccal midazolam. It's also used as an epilepsy rescue medication as well, but the dose is significantly less, and it's just to help her muscles relax enough to get her out of that spasm cluster. She does also take regular medications to help keep her muscles relaxed in between and to help prevent the dystonia from happening. So she takes medications such as diazepam, baclofen and clonidine. These are all muscle relaxants that she takes between 2 and 4 times a day to help keep her muscles relaxed enough to stop them going into a dystonic spasm. Mostly we found that the triggers for her dystonia include tiredness and pain. Now she gets a lot of pain at the moment because of her hips. So for those of you that don't know Astrid has bilateral hip dysplasia, which means that her hips are coming in and out of their sockets. This can cause her a lot of pain. So quite often we find that she gets dystonic when she's in sitting position because that's the position that's hurting her hips the most. And yeah, so that level of pain can then cause her to get into a dystonic cluster, and then that can cause more pain, and it's just a vicious cycle really. There are other methods of treatment for dystonia. These can be things like Botox and injections into the muscles to help them stay relaxed, and also you can have kind of some brain stimulations and surgery, but they're much more extreme, and we're not quite at that level for Astrid. She is pending surgery for her hip, so we're hoping that once the hip surgery has taken place, this will alleviate her dystonia tenfold. But it does really depend on if this surgery works for her or not. So it's a bit of a what if at the moment. We're hoping that it can help her. But yeah, I'm going to put up some examples of her dystonia now. So quite often, as you can see, these are when she is in sitting position, mostly in her chair that we feed her in, but you can see her muscles there are like really shaking in her hand. And then in this second video you can see how red she is in the face, so that's how much her muscles are contracting and how hard her body's having to work to stay in that position. And it's actually can be quite distressing to watch because there's not a lot I can do about it, except change her position, and even sometimes that doesn't help, and we just have to kind of try and comfort her and reassure her as much as possible until she is relieved enough to come out of that cycle. But yeah, dystonia is one of Astrid's more distressing conditions because there's not a lot out there about it, and she does have frequent dystonic episodes, and I couldn't even count how many times she has a day, but it's, I'd say over 50 as a ballpark figure. But yeah, she gets like this multiple times a day, and it's really distressing to watch.